Brad Conder here, and today's another edition of Ask the PT. I wanted to cover a question I got today from one of our good clients or patients, and it kind of might lead into some other questions that I'm going to try to do more of soon as far as particular topics. And the one topic that I wanted to try to cover is arthritis. Oftentimes you might go to your doctor or have another specialist and say you have arthritis, there's nothing you can do about it. I tend to disagree with that type of point of view, and there's reasons why that is, and it doesn't mean that the doctor is wrong. It doesn't mean that other people are wrong necessarily, because it truly is. Arthritis is a natural thing that happens in your life. We all kind of age, and we all change over time, and so arthritis is known to be a normal thing. Now, some arthritis is worse than others, depends on what we do. So that's what we want to cover today, is actually hand arthritis. So hand arthritis, actually something I deal with a lot, and I'm going to deal with a lot. Physical therapists, massage therapists are known to have like a lot of thumb arthritis, like right in this area here. Actually, I've been having a lot right here as well, and I do a lot of my own stretching kind of all day to try to help that out. So when it comes to hand arthritis, there's some simple things that we can do to kind of help that out. First thing is make sure your hand and wrist stays really flexible. So here's an example of some stretching. So a lot of times I'll show people stretches, hand, fist, stretch. Most people actually won't be able to do this very well. Like, that's about as far as they can go, or that's all as far as they can go. The whole hand and tendon is extremely tight. It's actually going to add a lot of pain to your fingers and to your hands if your whole wrist and tendons that go to it are very tight. And also to follow that up, so your wrist stretch, hand stretch. Very simple. It'll help your wrist, but also help your fingers, and that's something that we want to kind of do on a consistent basis. If it does hurt, let me know, because it's something that should not hurt. It should just be tight, something you want to work on throughout the day or throughout the week. Some other simple things. Actually, heat does usually feel good for hands. So I've oftentimes recommended like Epsom salts, warm water, or even a paraffin bath. I mean, in physical therapy, they used to do that a long time ago, but you can get a paraffin bath at Walmart for like $30. Put your hand in the warm paraffin bath, make it feel good, make your skin feel good. That's a good way to kind of help that as well. And then lastly, there's some exercises you can work on. I don't have it with me, but you can take a rubber band and just kind of work on some actual finger exercises. You can do some gripping exercises. And just like I said, just kind of keep your fingers moving. The last thing I would say as far as arthritis is that arthritis likes motion. You can't cure arthritis, but you can make your joints and your muscles move well, which will take a lot of stress off of arthritis, especially when it comes to knees, shoulders, ankles, stuff like that. Hands are a little bit harder because you use it all the time, but keeping them moving, keeping them warm, keeping them stretched out, keeping them strong can go a long way to kind of help that. And again, you're not going to cure it, but you can help it. So hopefully these tips helped you out. I might actually follow this up with some other arthritis tips, kind of some myths about arthritis. Share this with anybody that you know of that might have questions about arthritis, and we'll continue to cover this in the future.